place of a preference for profits. Change must come through a grassroots movement whose voice cannot be still.
This is Sean Bradford Dodson Green, and this is his first protest. I think in the long term, I believe that the ultimate goal should be a single-payer system. A single-payer system is a government-financed, privately delivered system. It's socialized in terms of responsibility for paying for health services. It's not socialized in terms of decision-making. I think that the term socialized healthcare system is often, it's bandied about, and I think, number one, people don't understand what it really means. Because, for instance, we have a socialized fire department system in this country. We have a socialized police department system in this country. There are certain things that the society decides are important. I think healthcare should be one of them.
Well, I don't think these reforms are going to happen with the kind of financial crisis we have unless millions of working class people really organize and fight for these things.
We believe the health insurance industry is trying to buy their way onto the table with healthcare reform. The health insurance industry has given, along with the pharmaceutical industry, $24 million to the members of Congress since 2005. That's 24 million reasons that the American people should be concerned that HMOs and drug companies are going to get their voices heard above the needs of the American people. We see this in two big points that the health insurance industry is trying to push. One, which is a mandate that would require individuals to purchase private health insurance. A plan like that would be essentially funneling customers to the health insurance industry. That's what they're pushing, and that's a plan that the largest Democratic recipient of health insurer money in Congress, Max Baucus, supports. Secondly, we know that the health insurance industry is trying to block any sort of public option for health care for the American people. They don't want the competition, so we're here to call out the health insurance industry for trying to purchase Congress's position.
People have questions? Yes, please.
Yeah, for Dan.
Sure.
What's NFIB's thinking on the the public plan option that's being talked about, having a government-sponsored plan of some type in a new reform type healthcare system?
We would have a couple concerns. First, I think our members generally favor a private healthcare marketplace, and secondly, we would have concerns whether you do in fact crowd out. By government competition, you crowd out the private sector. So I think those would be our concerns.
Common enemy that we have is a private health insurance industry that consistently puts profits before people and who consistently has loose, empty rhetoric, and they talk about wanting reform, but they don't want real quality reform. So it's not about what the solution is today. What we're getting together today to talk about is the problem, and the problem is the private health insurance industry.
I think the elite class, the ruling class in this country does control everything, and I think in terms of health care, even if they would expand Medicare, and they would provide single payer, which is probably the best plan on the table now. I think it would give them the opportunity to really cut back on health care for people, and that's a real danger.
We did this analysis of the top health insurer and drug company donors to Congress. We pulled President Obama out of that analysis because obviously he's not in Congress anymore. However, the president did receive over $900,000 from employees of health insurance companies and over $1 million from employees of drug companies. The big difference with President Obama is that he didn't take that money directly from pharmaceutical or insurance industry PACs. And that's a big change from days previously.
We as a nation must supply quality access to health care for all Americans.
Think about your children, your aunts, your uncles, your moms, whatever it is. Just think about those people. That's us.
I would say find a job.
I'm not so sure that you could put that on camera. I think what they do is unconscionable, and I don't think that you can put corporate profits over people's health. There's a fundamental right to access to health care in this country, in any country, and I think the idea that you deny people the health care they need to make a corporate profit is disgusting.
I would say as a starting point, we are not in favor of a public plan. Obviously, there are nuances to levels of public involvement, and that is a devil in the details kind of question. We would have concerns about anything that looks like it could be destructive to the current private marketplace in healthcare.
Donate today and receive a new documentary film available to members of the Real News Network. The History of the National Security State with legendary author Gore Vidal. Bonus features of the DVD include an in-depth response to Vidal from ex-CIA analyst Ray McGovern, who served under 7 U.S. presidents, an exclusive interview with Colin Powell's former Chief of Staff Larry Wilkerson, and an insightful interview with oil policy analyst Antonia Juhas.
The news magazine of the screen. Living glimpses of history in the making.
Hollywood and Washington is a symbiotic relationship. They both deal with illusions. Reality doesn't often play much of a part. I think I saw through the myth of the Cold War almost from the beginning. I was a Washington political kid from a political family. Roosevelt first had radio because he had this great speaking voice and everyone liked to hear. Truman proceeded to break every arrangement that Roosevelt had set up for a peaceful coexistence. And Truman thought that it would be a good idea. Why not just stay armed all the time? And then he devised the national security state. You've got to go up and swear allegiance to the United States or else you're a commie. I mean, we had imported fascism. We get Dwight Eisenhower, who said that we have this great military industrial complex. It is a dangerous thing. And he said this is going to change everything. And the way our country's governed is going to change us politically. Along comes Jack Kennedy, who wanted to make his mark, believed in the Cold War. But he said in this kind of politics, it is the appearance of things that matters. I think everybody should take a sober look at the world about us. The national security state still exists, only it isn't communism anymore, it's terrorism. This is the most serious thing that has happened in the history of the United States. Knowledge is power. We need an honest news system.
We need the real news.
This is the sort of thing we can build right now without anyone else's permission from the government or from the business community. It's the power's in our hands.
If we're not going to sleepwalk into more wars, we think we need to start with a television news network that won't bow to pressure and has the courage to seek facts. And that means independent economics. And that's why we need you.
Make a tax-deductible donation now of at least $10 a month or a one-time give of at least $75. As a thank you for your support, we will send you the new documentary film, The History of the National Security State.